Setting up an emergency medical kit is crucial for preparedness in case of unexpected situations. Whether you're at home, in your car, or facing an evacuation, having the right supplies can make a significant difference. Here's a comprehensive checklist to help you create an effective emergency medical kit. 1. Container and labeling. Store your items in a clear, waterproof container with a secure lid. Label it as a first aid kit and include an emergency contact list, essential medical information, and any specific instructions for using the supplies. Regularly check and update your kit to ensure everything is up to date. 2. Basic first aid supplies. Adhesive cloth tape, 10 yards or 10 meters by 1 inch or 25 millimeters. Antibiotic ointment packets, approximately 1 gram each. Antiseptic wipe packets. Aspirin packets, 81 milligrams each. Emergency blanket. Breathing barrier, with one-way valve. Instant cold compresses. 3. Medications. Include at least a 1-week supply of your regular medications. Create a medication list with details of your prescriptions. Mark your calendar at 6-month intervals to check for expired prescriptions and replace them as needed. 4. Additional items. Bandages, assorted sizes. Sterile gauze pads. Adhesive bandages like Band-Aids. Scissors. Tweezers. Cotton balls or swabs. Disposable gloves. Thermometer. Pain relievers, such as acetaminophen or ibuprofen. Burn cream. Eye wash solution. First aid manual or instructions. Emergency whistle. Notepad and pen. Emergency phone numbers. Personal hygiene items, like toothbrush, toothpaste, etc. Remember to customize your kit based on your family's needs, including any specific medical conditions, allergies, or special requirements. Regularly review and replenish your supplies to ensure your emergency medical kit remains effective and ready for use. If you enjoyed today's video, please subscribe and ring the bell notification as to not miss the next edition.